Good evening. I'm Kelly Lazar with the Community Awareness and Prevention Association. Thank you for joining us for our Health and Wellness series. Tonight, we have the pleasure of welcoming Jeanette Troiano. Jeanette is with Applewood Centers. She is a licensed clinical counselor. She's going to be talking tonight about staying ahead of anxiety, how to support your student and yourself during a pandemic. So Jeanette, we're so grateful that you're here to talk with us, and I will turn it over to you.
Okay, thank you so much, Kelly. And thank you to the Brecksville Broadview Heights School District for inviting us to participate. We're really excited to talk with you guys and connect tonight on the topic of anxiety and how to support your student, yourself, your family during this pandemic. So I wanted to kind of start off with a little bit of a relaxation activity. So I know people are still joining us and kind of settling in. If you're going to be multitasking, that's okay. But I ask that for, 30 seconds to a minute, you just kind of put things aside and follow along with my instructions here. So as much as possible, if you're sitting down, kind of get comfortable in your chair. And we're going to take a deep breath in. We're going to take in the air in through our nose and out through our mouth. So when everyone is ready, we're going to start the inhale and then release out. We're going to kind of follow along with the prompts on our screen. So the first thing I'm going to ask you to do is relax your forehead. Let the muscles and the tension in the hairline area around the eyebrows just kind of release. We're going to unclench our jaw. And sometimes you might have to kind of, rub a little bit around where it connects to really loosen it up. We're going to drop our shoulders away from our ears and down. This is going to lift our chest. Stretch your fingers, wiggle your toes. And if you'd like to close your eyes before we take this last deep breath, feel free. We're going to take a deep breath in and exhale out. So hopefully that's allowed everyone to kind of focus in and really be present for this next hour. We're going to be talking about anxiety, which can be an anxiety-provoking topic at times, but hopefully we do it in a way that's informational, educational, and useful. So all of us experience varying levels of stress, tension, and relaxation at different times in our lives. And the tension we experience in response to stress can present in different ways. At times, it might be an emotional reaction, feeling worried, fearful, frustrated. Stress also affects the way that we think and the way we process information. So for example, when we're stressed, we tend to focus more on the negative events, negative thoughts, and negative emotions that we're experiencing. But we can also have very physical responses to stress in our bodies, such as muscle tightness. Tense muscles can aggravate some kinds of pain, and it can use up energy that we might need for other tasks. So hopefully these few steps have kind of helped you and get into the mood of relaxation, because that's definitely going to be covered along the way. So stress is a word that we're all too familiar with, but it's different for everyone. And although it's generally used with a negative connotation, the word itself really means responding to any kind of demand. We experience light stressors, which are usually a little bit more expected and impact us for a more predictable amount of time. This might be traffic, work deadlines, testing, monthly budgets. We also experience heavy stressors, and these are less predictable and they impact us for an uncertain amount of time. Examples of this include car accidents, illnesses in ourselves and others, serious changes in employment, and of course, as we have all come to be familiar with over the past year, the current global pandemic. This is part of what we would call chronic stress, which has a significant impact on most major body systems: immunity, digestion, cognition, cardiovascular health. And despite the fact that we often hear the term stress-free as something people are trying to achieve, stress does have a function. So as we can see from the top graph, stress works on a continuum. We all experience it at one time or another. And we can use this spectrum or one similar to it to describe how much stress we are experiencing and identify when we need to take a break. That break time is probably going to fall in the orange to red category, the too much stress, overloaded, burnt out category. However, we can also see from the top graph that, believe it or not, there is an area called optimum stress. And I know a lot of people might be surprised by this. However, some of us might have actually experienced this at points during quarantine. This is when we don't have enough being asked of us, whether that's projects, outlets, relationships, just general day-to-day tasks to engage with, and we can feel bored, sometimes even useless. But what we're kind of aiming for is that yellow area, the optimum stress. We want to feel that we are in need and that we can also meet the demands that are being asked of us. If we look at that bottom graph, this is a little bit more of a visual aid that can be helpful when you're dealing with the stress response of children and adolescents. You might have seen something similar to this when you go to the doctor and they use the pain chart, and it really helps us make an abstract concept more concrete for children and adolescents. So at times, we address stress in our students or our children when they've reached a 9 or a 10 on the spectrum. Waiting until that point is when we're going to start to see some significant changes in behaviors or a reduction in their functioning. Part of our goal as adults is to start intervening when we notice they're in the 4, 5, 6, maybe even in the 7 range. Because if we can address the symptoms and the stress at a lower level, we're going to be able to implement the necessary strategies before it really becomes an emotional struggle for them. So what do kids stress about? There are age-appropriate stressors for children based on not necessarily their birth age, but their developmental age. 2 and 3-year-olds, animals, darkness, shadows. 4 and 5, bugs, dogs, separation from parents, monsters. As we get older, we see, things that are more similar to adult worries. So germs and illness, how they're going to perform in different situations, safety, public speaking, world events and issues. And I think it's important to note that sometimes as adults, we might minimize the stressors of children. We think that because our adult worries are more complicated, that the stress a child faces is somewhat easier and less serious. One example I use is with my high school students. A lot of times I'll have someone, opening up and upset, crying, agitated, really distressed. And as they tell me what's going on, it sounds like, so my ex-best friend posted this heart emoji to my ex-boyfriend's fan page on Facebook, and then they responded on Instagram, and they were on Snapchat, and I was private, I couldn't look. And as an adult who, doesn't use social media that much, I don't fully understand the impact. But I ask questions, I validate, I try and understand why that's important to them in their world. And that's going to give me a little bit of a better idea of how to respond in an appropriate way and acknowledge it without amplifying it. So the stress that a child experiences over friends, homework, testing, those will impact them in the same way that a high stress situation can impact an adult. We know what's developmentally appropriate, but how much are kids actually worrying about these different issues? So the information we see here is based on a study of 11 to 17-year-olds. And I wanna make sure that I let people know that this was prior to COVID. But we can see by these first 4 categories how COVID might have impacted your child's stress level. I have some clients that were really successful with their online classes, and they felt less worried about their appearance, social interaction, trying to manage the schedule of chores, class, sports, part-time job. I would say for the majority of the clients though, their baseline level of stress about these 5 different topics did increase during COVID due to the transition to online learning, especially for the 10th, 11th, and 12th graders. The future looks even more uncertain than it did before. And they watched their peers who were older in the spring miss out on some of those milestones. So even worrying about how the end of their high school career will look is something that's on their mind. We know that not being able to physically attend school made a lot of kids feel disconnected, and really increased those feelings of loneliness. Body appearance, a lot of the kids and clients weren't really being as active. They weren't out and about. They weren't moving the same way they were when they walked to school or they moved between classes or they go to gym. So they became a little bit more self-conscious about their appearance, even though they weren't getting the same type of feedback about that. Stress and anxiety are two words that are commonly interchanged when we talk about them in everyday conversation, but they really represent two separate responses. As we can see here, both of them affect our sleep, our breathing, our immunity. They cause feelings of doom. They can lead to poor concentration, affect your appetite, impact your mood, and definitely increase irritability. However, stress is typically from an external cause, while anxiety is a little bit more related to internal triggers. Stress is going to have a milder physical response. Anxiety is going to be pretty significant in terms of how you feel it in your body. And stress usually resolves itself either when the event or the trigger has passed, whereas anxiety is persistent. Even if there is one, predominant trigger, that anxiety is going to continue after that specific trigger has passed. And like stress, anxiety is a normal part of childhood, and every child goes through phases. Some may only eat orange foods or count in twos. Others might have an imaginary friend or reoccurring nightmares about monsters under the bed. The difference between a phase and an anxiety disorder is that a phase is temporary and usually pretty harmless. But anxiety disorders tend to become chronic, and they're going to start to interfere with how your child functions at home, at school, with their friends, to the point where they become distressed and uncomfortable. And unlike a temporary phase of fear, such as going to see a scary movie and then having trouble falling asleep, the reassurance and comfort from adults is not enough to help a child with an anxiety disorder get past the fear. As a clinician, the things we're going to look for to determine if the stress or worry has developed fully into an anxiety disorder include the duration of the worry. So for most anxiety disorders, we're going to say if the symptoms persist past 6 months, that's something that's clinically significant. Now, if it's a disorder such as separation anxiety, that's going to be a shorter amount of time. After about 4 weeks, we start to say that that's clinically significant. We're also going to look at what types of things the person is worrying about. A generalized anxiety disorder means that the person worries about a variety of topics more days than not. Whereas if it's a separation anxiety or an adjustment issue, those are responses to specific situations that they're experiencing. And we're also going to evaluate if the worry is out of proportion to the actual likelihood or impact of the anticipated event. So for example, a child that experienced a loved one going through COVID over the last few months, it would be appropriate and expected for them to be anxious if they're returning into the world, physically going to school. That is an understandable threat. Anxiety and depression are also pretty commonly linked. As we can see here, about 7% of children between 3 and 17 will be diagnosed with an anxiety disorder. About 3% will be diagnosed with a depressive disorder. However, of that 3%, 75% will also have anxiety. They often co-occur, as well as co-occurring with ADHD as people get older, substance use, eating disorders. If we look at the chart here, we can see some of the key differences that are going to help us differentiate. One is that anxiety typically causes the individual to focus on the future and what could go wrong, whereas depression, which can also be about the future, is a little bit more focused on past negative events. Those are going to weigh more heavily on the day-to-day person who's experiencing anxiety. We also have the physiological responses to anxiety. That looks like increased energy, being amped up, more outward behaviors that let us know someone's experiencing anxiety, whereas depression is a little bit more inward. They might have decreased energy, they might seem lethargic. The distress is going to be internal. And we know that depression is also much more strongly linked to safety concerns, such as cutting, running away, and suicide compared with anxiety. So how does a child respond to anxiety? An adult is going to say, I'm anxious, I'm worried, but most children don't have the self-awareness or the emotional vocabulary to actually verbalize what's happening in the moment. Instead, their anxiety is going to manifest in other ways. This is in part because it is based on a physiological response to a threat within their environment. So as we can see within this chart, Anxiety might present as anger, as trouble sleeping, as defiance, avoidance, over planning, disruptive behavior, negativity. These are all going to be sort of manifestations of that underlying anxiety that the child might not be aware of. And if they are aware of it, they might not know how to communicate that. So, as a clinician, when a parent or guardian starts to report the things that we mentioned on the previous slide, we sort of translate these into clinical symptoms. If we look at the domain of thinking and learning, we're going to be noticing concentration problems, memory problems. That child is going to not necessarily just have poor problem solving, but their previous problem solving abilities might deteriorate. They're going to have more significant amounts of worry about school and performance can be academic, athletic, social, relational. There's a whole bunch of different stressors within that category. We also have behavioral, restlessness and fidgeting, avoiding tasks, rapid speech, withdrawal. Those are all things that are pretty apparent to parents and guardians. And I kind of held off on irritability and perfectionism because irritability, most kids, once they get past 10 or 11, parents and guardians have kind of accepted that, they're going through their teenage years, they're starting puberty, they're going to be a little bit irritable. And then perfectionism, we're going to talk about this coming up, but this is a little bit of a red herring. We wouldn't necessarily think that perfectionism is associated with anxiety, but it is one way that it manifests. And then the last domain is physical. And sometimes kids will be able to verbalize this in the sense of like, I don't really feel like going to school today. I have a stomach ache, or I have a headache, and it's sort of vague. It might not be 100% accurate, but for them, that's a really good way of making it concrete in terms of why they don't want to go to school. But it might also be these physical responses that they're not necessarily aware of. They might have flushed skin, they might feel dizzy, sore muscles, they might really have a stomach ache or feel nauseous. Especially teenagers, they're going to notice sort of the rapid heartbeat or tight feeling in their chest that can sometimes, as it progresses, lead to panic issues. And I mentioned perfectionism because we have high functioning anxiety. Now, this isn't a diagnosable disorder. However, people with high functioning anxiety, on the surface, they appear to be very successful, together, and calm. Some might say they're the typical type A personality. They excel at work, at life, at friendships. However, what they're experiencing on the inside might be very different. People with high functioning anxiety experience many symptoms associated with anxiety disorders, but do not meet the actual criteria. We do have a question in the Q&A, so I'm going to pause here and kind of address it. Do you, as a clinician, see more children with anxiety and depression because of COVID and the isolation that has resulted from it? Have you seen many children having a reaction to what happened 2 weeks ago in the Capitol? So I primarily work with high school students. The majority of my clients are between 13 and 19. And I would say that 25% were aware of what happened in the Capitol 2 weeks ago. And in those situations, I kind of will, bring it up in session if it's pertinent and sort of graze by it to see if they're aware of it. I don't want to, increase their stress by making them hyper aware of everyday events. But at the same time, a lot of them are of the age where they can vote and where they can be, involved in social justice and other movements. And I would say with COVID, initially we were getting two responses. A small group was very aware of the impact COVID was having immediately. In the school district where I work, we had a 3-week spring break, and there was a few kids that knew, hey, we're not really going back after this, are we? I would say for the majority of them, their initial response was like, okay, cool, I can sleep in, I can work from home. We're gonna kind of just, segue into summer, and they didn't really stress. I would say it was September when the rest of the kids kind of started to be impacted by the fact that they weren't going back in person or they were going back hybrid. They'd missed out on vacations. They weren't getting homecoming. I would say the impact was a lot stronger in the fall. and it's kind of increased going into the winter. All right. So we're going to kind of jump back to the high functioning anxiety. Um, if you or someone you know has high functioning anxiety, you might notice that it actually propels them forward rather than leaving them frozen in fear. For example, someone with high functioning anxiety, they might be the first person at the meeting. They might be overly prepared. They're offering to help other people. They're open to feedback. It seems like they're the ideal coworker. But what we don't realize is that these behaviors are a result of some intense fears. They might be afraid of failure, afraid of being unworthy. Um, they might feel like their worth is defined by their achievements. So if they don't reach their own expectations, then they feel like their value isn't what they thought it was. So we see in this chart here from one of my favorite Instagrams, Blessing Manifesting, is that someone on the outside who looks like they're always in control, internally, it might feel like I have to be in control because something will go wrong if I don't do everything myself. And again, this might not meet the criteria for a clinical diagnosis, but it's still going to significantly impact their day-to-day life, their physiological and emotional responses. And if those individuals don't ask for help or support in some way, it's more likely that they will develop more severe and debilitating psychiatric conditions later in life. So now we are at the function of anxiety as an adaptive response. I think we've all probably heard that term, fight or flight. It's kind of expanded to fight, flight, or freeze. And in some circumstances, especially around trauma, they've included fawn. So fight, flight, freeze, or fawn. For our purposes today, we're going to kind of keep it focused on the fight or flight portion. But this is also known as the acute stress response. And this refers to the physiological reaction that we've been talking about. And it occurs when we are in the presence of something that is either mentally or physically frightening or threatening. And that term, fight or flight, it represents the choices that our ancient ancestors had when faced with the danger in the environment. So as we can see from this flow chart, when we or a child perceive a threat to ourself, our body, our safety, we release chemicals, adrenaline, and those other similar, boosters that are going to give us the energy to either fight the threat or physically run away. Now we have freeze up there, and I kind of think of, the original Jurassic Park, where if I don't move, maybe it'll go away. Those situations aren't as frequent, but in theory, this energy is going to increase our heart rate, blood pressure, breathing rate, and cue us into the idea that it's time to perform in some way. We can see that there's two different ways it can go after our body has this physical response. If the threat is resolved, we're going to return to baseline. But if the threat isn't resolved, in the future, we're going to have an increased perception of danger in similar situations. So for people who don't experience anxiety or haven't experienced significant anxiety, I think one of the best ways to kind of put yourself in this fight or flight response is to think about the last time you reached into your pocket for your car keys, or you looked in your purse for your cell phone and it wasn't there, and you have that moment. And for me, it's my stomach drops and my heart starts to pound and I get really hot and heated and red around the throat area. And my brain is telling me, like, dump out your whole purse, go through everything. It's got to be there. Find it, figure it out. And then that's not helpful. If I'm not looking for things in an organized way, I've overlooked the keys, I go to the other room, and it just kind of spirals from there. But if you can check your other pocket, oh, I put it in there, then you kind of start to feel those responses going down. But in reality, it takes 2 minutes of calm before our body even stops making adrenaline. And it can take between 20 to 60 minutes before our body is going to return to the pre-arousal level, before we have time to kind of let that adrenaline work its way through our system. So if a child has a really strong fight or flight response, in theory, it's going to take at least 22 minutes for them to kind of get back to their baseline. But it can take 60 plus minutes, especially if the threat is continuing or persisting, or they're not 100% confident that it's gone. And this is important. We don't want to get rid of the fight or flight response because it plays a critical role in how we deal with stress in our environment. And at times, fight or flight can help us perform better in situations where we're under pressure to do well, whether that's school or work or sports or social engagement. And in cases where it's actually life threatening, the fight or flight response is necessary for our survival. By gearing us up to fight or flight or flee, this response makes it more likely that we're going to survive the danger. However, because it's automatic, it isn't always 100% accurate. Sometimes we respond with the fight or flight when there is no real threat. And a good example of this is phobias. So you might be afraid of heights, and every time you have to go to a meeting on the top floor of the building, you notice that your heart rate speeds up, you start to sweat, you might feel a little bit shaky. Your body is on high alert because it's seeing a threat that isn't really there. That's not to say heights aren't scary, but within an office building, within a conference room, the danger is probably pretty minimal. So understanding our flight or fight response is one way to help us cope with the situation. When we notice that the physiological reactions are kicking in, when we're starting to become tense or when our body temperature is rising, we can start to implement coping skills or relaxation skills to prevent those symptoms from escalating. So as adults, when we're working with children or adolescents, there are certain things we might do that are unhelpful. And this isn't to criticize anyone, this is just to kind of put it out there and provide a framework for managing these behaviors. The first thing there is always avoiding anxiety triggers. If we always help the child avoid the things that make them anxious, we're reinforcing that anxiety over the long run. Now, there might be times when it's needed. You might need it for a short-term solution to get through that situation. But if we make it a pattern, we're validating that that behavior is okay. All right, and we have a question. For children that are overly anxious about one or more things all the time, were they born that way or because of something I did or something that happened when they were little? So it's a really good question. And this is usually a combination of environment, genetics, personality. There are certain people who are sort of characterologically predispositioned to anxiety. This can be reinforced in the environment, and it's not uncommon for anxious parents or parents that express their anxiety to kind of have children that are more anxious. Now, at the same time, the more intelligent you are, the more likely you are to have anxiety. So that's a little bit of a double-edged sword. It shouldn't be a punishment for being smart, but having the awareness and the intelligence to understand the threats and the dangers in different situations does make us a little bit more likely to worry about those things because we're aware of them. But for your question, you said, is it least because something I did? I want to kind of take away any blame or guilt that might be happening because there is no perfect parent. There is no one right way to parent. So the fact that you're in attendance here today, you're thinking about it, you're asking questions, that shows that you're heading in the right direction. Okay. Next, we have making unrealistic promises. So if a child says, I know I'm going to fail this test, we don't want to say, no, you're going to be totally fine, because we don't know for sure. What we want to do is express our confidence that they're going to be able to manage whatever happens and kind of reinforce, hey, you study, you're going to give it 100%, and whatever happens, we're going to be okay, and we're going to figure out the next move, okay? And just kind of giving them that reassurance and the validation. We want to maybe avoid taking their behavior personally. If they are having a meltdown about getting to go into the doctor's office, they're not trying to, throw the whole day's schedule off. They're not doing it to make anyone's day more difficult. It's just sort of the function of their anxiety. They need to use that behavior to make them feel safe again. We have, arguing or getting into a power struggle. It's really hard to persuade someone who's having a strong anxiety response that they're not in danger, that there isn't a threat. And when we get into this power struggle, we might feel the need to win the conversation. And this isn't really a situation that we can win. It's more about collaboration. We also have giving them an immediate consequence in the moment as it's happening. So we'll use this example again of not wanting to go to the doctor. Starting to, identify the consequences, saying, well, if we don't go to the doctor, then we're not going to play video games later. That's likely to kind of increase the worry because now, uh-oh, I might not get to do the thing that I really like to do after the doctor. It doesn't mean there aren't going to be consequences. And it doesn't mean you can't point out sort of the logical effects. So if we don't get to the doctor on time, we're definitely not going to have time to stop at the bookstore afterwards. That's okay because it's kind of helping them process and problem solve as they're experiencing the anxiety. But sort of landing immediately with this is what's going to happen is probably going to amp up their emotions. We have ignoring or dismissing their worries. So we don't want to just completely disregard, even if it's something that's very unlikely to happen. Listening, validating, which we're going to get to, and just hearing them out is going to give them the sense that, okay, I can trust my emotional reactions. Whereas ignoring or dismissing is going to kind of invalidate, and they might start to question whether or not, they really understand how to respond to different triggers. We also have giving a lecture, and this is especially true with adolescents. This takes the focus to us and it kind of disempowers them from being part of the solution. And if they're anxious, they're already probably struggling to sort of stay focused, stay present, stay in the moment. And a lecture, a long, diatribe from an adult is going to probably cause them to tune out. We also have comparing them to another child. So, John's already in the car. John's been ready for 20 minutes. John's waiting on you. Why are you having all these problems getting in the car for the doctor when John's already done it? This does not usually lead to the child saying, okay, let's go. It's more, okay, well, now I don't want to go to the doctor and I'm not doing it as well as my brother. So it's just kind of reinforcing the negative aspects of that situation. And then these aren't specifically on the slides, but we want to avoid asking leading questions. So definitely encourage the child to talk about their feelings, but try not to ask leading questions. So how are you feeling about the test today versus are you anxious about the big test? It gives them more of a chance to kind of describe in their own words and from their perspective what they're experiencing rather than sort of preempting it with that anxious feeling. And when we can, keep what we call the anticipatory period short. So if we know the child doesn't like to go to the doctor, telling them about it a month ahead of time gives them a month to worry about it. At the same time, we don't want to wait till we're pulling in the parking lot and they're realizing we're at the doctor. Letting them know the night before or that morning sort of gives them time to emotionally prepare, but not to the point where their anxiety has escalated. So what do we want to do? There are lots of different options for parents and guardians to implement some of the same skills that therapists and guidance counselors and teachers and social workers use. We could call it the CARD system, and this is a resource that will be available through a Google Doc at the end of the presentation. And I'm now remembering that I forgot to mention at the beginning of the presentation that this is also being recorded. So if you have someone that wasn't able to attend live, they will be able to access this afterward. Okay, so we have the CARD system. The C stands for comfort. This is providing that emotional first aid in the moment. Talk with your child about how they can cope so they can feel more in control of that situation. It helps if you kind of know your child's go-to coping skills, whether that's listening to music, coloring, doing yoga, playing with their friends, taking the dog for a walk, kind of having those go-to emotional supports that you can offer to them in those moments. And we definitely want to validate their concerns. And validation does not necessarily mean that you're agreeing with them. So if the child is afraid of the neighbor's dog, even though it's a tiny little 10-pound Chihuahua, we're not saying that, yes, you should be afraid of the Chihuahua, but we're saying, I understand why you might be. It's yappy, it barks, it gets out of the yard and comes at you sometimes, and that's okay. So validating without necessarily agreeing. And then creating daily routines. This was especially important throughout COVID when the day-to-day activities of the school day kind of, went out the window for kids because they're in the home. They might be online for part of the day, for all of the day. They're not, within the same structure of the school. So having those daily routines for them is really important. And I use routine rather than schedule. The schedule sort of implies rigidness where things have to happen at a certain time, whereas a routine is more of we have a general flow to the day and we know what to expect and it's predictable without feeling restrictive. The A stands for ask questions. So answer your child's questions using age appropriate language. We have examples here. How are you feeling? How can I help? What questions do you have? I mean, it can be as simple as tell me more about it. And a lot of times I use minimal responses or nonverbal communication, just head nods or like a head tilt, which indicates I need a little bit more information. The R stands for relaxation. And we're going to talk about this a little bit more in the upcoming slides. But as you see here, we have practicing deep breathing in fun ways, using different sensory tools to increase a sense of calm, doing guided meditation, yoga, ASMR, listening to music with your child, and practicing positive self-talk. Um, Self-talk is sort of the internal dialogue we use with ourselves all day, every day, and it can sound positive, negative, or neutral. As adults, the more we can practice that positive self-talk out loud, whether it's about ourselves or the child, the more they're going to pick up on it. They really do rely on learning from watching us. So in that example of I can't find my phone or my car keys and I want to dump it out and go into panic mode searching for things, there was a child or teenager there kind of saying, oh, okay, I'm not going to panic. I'm just going to take a deep breath. I'm going to look through my purse. It's got to be here. I know I can find it. If not, I got the backup keys. Just kind of talking through the situation in a positive way, and especially about themselves. So I can handle this. I can do this. This is going to be a tough test, but I'm ready for it. Just modeling that behavior is going to translate over to the kids. And then lastly, the D stands for distract. So if based on the situation or the resources or the timing, you can't do those other three things, it's perfectly okay to distract. Take their mind off of the stressor for at least, the near future to get through whatever that situation is. Talk about another topic that's important to the child. Do an activity they like, whether it's coloring or puzzles, and going outside for a walk or trying another type of light exercise. If nothing else, that movement is going to boost the endorphins and create that positive feeling. So this slide is obviously specific to managing COVID-19 anxiety. And, we're nearing what we hope is the end of it as we roll out the vaccine. But for both adults and students or children, sometimes avoiding excessive exposure to the media is helpful. There was a certain point when we think we all had an information overload and we weren't hearing positive things. It was just more reinforcing more of the negative. So at that point, do we need to continue engaging with it? Maybe not. But staying connected to people through calls, text, video chats, that's an important piece because we all felt the difference from quarantine to pre-COVID in terms of social interaction. We want to add extra time for daily stress relief, and that next bullet point, self-care. And especially for adults, I know self-care has kind of been a buzzword the last couple of years, and sometimes it can take on this connotation of being selfish or sort of short-term solutions. So people might say, oh, I'm going to sleep in today. I'm just going to do some self-care. And yes, it's okay to sleep in. That is a form of self-care. But it's not necessarily sustainable and it's not necessarily going to help you in the long term. So maybe going to sleep 20 minutes earlier or putting the cell phone on the other side of the room so we're not tempted to look at it, changing your sheets. Those are all different forms of self-care because they're focused on things that really bring you joy. And as adults, this isn't something that we can typically just squeeze into our day. I don't think a lot of us have, huge extra chunks of free time where we're just sitting around wondering how we're going to fill that. So self-care really has to be intentional and a habit that you implement through scheduling and time management. And for kids, we want to reassure them that they're safe, let them talk about their worries, share and model our own coping skills, and be very mindful about their exposure to the news. And again, that structure and routine. So now we have mindfulness and relaxation skills. And mindfulness is definitely a hot topic in the mental health world. It has been for several years. And as therapists, we really try to pass on this set of skills to our clients and their parents or guardians because they're so easy to use and there's so many different ways to implement them in ways that are fun for kids. But in the most basic terms, mindfulness means paying full attention to the present moment without distraction. It means slowing down and really taking notice of what we're doing, even if it's just focusing on our breathing. Being mindful is the opposite of multitasking, which as adults is sometimes we're sort of conditioned to do. But when children, teens, or adults focus on being mindful, we slow down, we take our time, and we allow our focus to be on something that's relaxing um, and calming. Research shows that practicing mindfulness has so many benefits. It can improve mental health symptoms. It can increase your ability to stay calm under stress. It can help you avoid emotional overreactions. It can help you get along better with others, increase sustained focus for longer periods of time, be more grateful. It's used by the military, it's used by professional athletes. It's really becoming pretty widespread, which is a great thing. And it can especially impact learning because it helps children and teens become better listeners and it helps them feel happier overall. And so the autonomic nervous system is the body system that controls our stress response, but it also controls our relaxation response. And we can't easily control this part of our nervous system with just our thoughts. So instead of trying to sort of think ourselves calm, one effective approach to turning that calm on is to access the nervous system through our body. Our body and our mind are incredibly closely connected, although we sometimes treat them as two separate entities. We might go to our primary care physician for physical ailments and a therapist or a psychologist or psychiatrist for our mental health symptoms, when really they're very interconnected. So we can see on the left side here, self-soothing through the senses, which is a quick and effective way to reduce the intensity of negative emotions. With all my clients, one of the first things we do is develop a coping skills box based on this list. And this list is just a short sample of the things that you can include, but it touches on all 5 of the senses. And I often kind of introduce it or explain it to my clients by asking them, can you smell into the past? Can you taste into the future? And 99% of the time they respond no. Every now and then I'll get a very creative answer. But the idea is that your senses really only work in the present moment. And so for a lot of people, they get anxious when they think about the future or they get sad when they think about the past. But if we focus on just this moment and what's being asked of us right now, that's really pretty manageable. And to tune into this moment, we can use our senses. And another way I kind of explain this is if your body is comfortable, it's going to help your overall emotional thermometer. Imagine a day like today, snowy out, you've had a long day. Let's say you carpool with someone and you're walking out of work. As you get to their car, you step in a puddle and you don't have your boots on and your socks are wet. And you were already kind of cranky, but now you got a long ride home, you get stuck in traffic, your socks are wet, and you're just uncomfortable. So that tiny bit of irritation from having a long day can amplify from that physical discomfort. Or if you go to the grocery store when you're really hungry and you can feel your stomach like growling, asking why you didn't have a snack before you left, you might end up with 12 different flavors of Pop Tarts in your cart because your mind isn't really making the same kind of decisions. It's not really this, on point as it would be when your body is comfortable. So it's within the mindfulness and relaxation category, we have a variety of choices. From the card system, we mentioned sort of fun breathing exercises. So especially for little kids, we can use bubbles, we can use feathers, we can use different types of drawing to help them sort of keep the tempo. We have guided meditations that include muscle relaxation or positive imagery, yoga or mindful movement games, mindful eating. This kind of surprises people at times, but a lot of times with clients, either individually or in groups, we'll do mindful eating using a piece of chocolate. And it takes it's a guided activity and it takes them about 15 minutes to eat one piece of chocolate, which if you have kids, that's a long time for them to wait. But we walk them through each of these senses. So you're looking at the chocolate. What colors are the wrapper? What thoughts are you having about it? How does it feel? Is it crinkly? What are those sounds? Then they open it. What's that smell? And then they usually get a little frustrated because once they put it in their mouth, I ask them to wait a second and sort of let it melt and really notice where they're tasting it. So that's definitely kind of the patience part of mindfulness. But we also have things like guided coloring or mindfulness scavenger hunts. So when we're not having January weather, giving the kids a list with sight, touch, sound, smell, taste. Go into the backyard and find me 3 things that are scratchy. Find me 2 things that have a strong smell. Find 1 thing that we definitely should not taste, even though maybe it looks edible. So just kind of engaging their senses in a fun way like that can really help them catch on to the idea of mindfulness and relaxation. We have some relaxation resources here. The phone apps, those are just a few. If you put in mindfulness, relaxation into the phone, you're going to come up with a whole list of options. We also have YouTube channels, which for me was something that I got from clients. I didn't grow up having the internet, and it's not necessarily my first thought when I think about resources. I think of books, TV, magazines, newspapers, old school media, as the kids frequently remind me. So YouTube is a really great channel for them. And even within Instagram or TikTok, there's some really positive and helpful resources that the kids can use. The little graphic on top, the You've Got Dragons, that's actually a bibliotherapy book that I use with clients. And even though it's designed for kids who are 4th to 7th grade, it also resonates with the high school students because it uses the idea of dragons as an analogy for stress or worry. So this is a resource for them, but it's available on Amazon. There's a lot of similar books like it, which we would call bibliotherapy. Then the chart here, 5, grounding with the senses. This is an activity that I teach almost all my clients from the start because it's a really great coping skill that they can use with A, not having any materials with them, and B, without alerting people that they're doing it. And when you're teaching it to the child, you're kind of doing it out loud verbally, but when they're doing it on their own, it's going to be in their own head. So you're just going to kind of instruct them like, okay, I'm going to ask you to describe 5 things you can see right now. And I want you to be really specific. So I see that my left shoelace is untied. I see that there's a blue, spot of paint on the white wall. Have them be very detailed and descriptive. 4 things you can feel. And this isn't necessarily things you're actively feeling, touching, putting your hands on. It might be, I feel that the air is cold. I feel my chair has a really soft cushion. I feel that I forgot to take this tag out of my sweater and it's a little scratchy. 3 things you can hear. And a lot of times, especially if you're in a quieter space or it's just you and that child, there might not be as much. So you need to be a little creative. And it might be the hum of the computer or the cars on the street outside. 2 things you can smell, and then 1 thing you can taste. Now, if the student or the child's in the cafeteria, they might want to switch it up. They might want to have 5 things that they can taste and 4 things they can smell. That's the nice thing about it, is it's pretty adaptable for the situation. And just kind of a general suggestion on resources is to be proactive about identifying what you have access to and what works for your child. So even though it's not hard to download an app or click on YouTube, we don't want to be in a grocery store with a child on the verge of a meltdown hoping we can connect to Wi-Fi. It's good to have those things sort of ready and accessible for those in the moment situations where you can't necessarily give them your full time or as much attention as it requires, but it's a little bit of an emotional band-aid at that moment. And then this chart is really helpful in terms of understanding when to seek professional support for either adults or children. From both clients and friends and family throughout the pandemic, I actually got a lot of questions about how to find a therapist. it can be a little bit of a confusing task. When you look online, you're going to see, licensed social worker, licensed counselor, psychiatrist, psychologist, marriage and family therapist. We like to throw around a lot of, words, CBT and DBT and TFCBT and EMDR, and it can be overwhelming. And then you get the intake paperwork, and it's a lot of diagnostic information and background information. And so kind of knowing whether your school counselor is available, whether they have an outside service, whether you can reach out to a pastor or a religious leader, whether you have a family friend that you can go to, just knowing who your emotional supports are is really critical during those crisis moments. But also knowing that it can take a little bit of time to get engaged with a service provider. There might be a wait list to meet with a therapist based on your insurance. The good news is that with telehealth, a lot of the barriers that we faced with physical meetings have kind of been, removed. And because of telehealth, we can meet with clients virtually. I do have a question. When should I use the 5 taste, see, feeling thing? So you can use this anytime that you're starting to feel anxious. So if you have a big test coming up and you're sitting here going, I don't know if I brought my calculator, and I don't think I have a number 2 pencil, and what were the thing about right angles? That can kind of cause our feelings to spiral and cause our body response to increase. So in those moments, if we can just bring it back to what's happening and think about, okay, what am I tasting right now? What am I seeing? What am I hearing? What am I smelling? That's going to bring us back to the moment, and it's going to help us be a little bit more realistic about what is being asked of us at that time. So we've kind of reached the end of the presentation here. I wanted to leave a little bit more time in case people had other questions, but Applewood does provide a variety of services. We have been a community-based mental health service in the Cleveland area for over 100 years. We have several locations, but as I said, with telehealth, we're really able to reach a lot more people and provide support in different ways than we were before. If you have any questions or comments, this is my contact information, and this orange anxiety resources should be a Google Docs link that will take you to websites and infographics and the card system from today's presentation. And I will make sure that sort of the point person, Kelly, has this as well, so that people who are maybe seeing this through Facebook Live or through another avenue are able to access those as well.
Jeanette, can you share that link in the chat box so that folks can go to that chat box link, and they can? I think I might be able to.
I was gonna say, I don't know.
So
I don't think I can access the chat.
So can you? So if you going to that, can you maybe right click that, or I'm just trying to see if.
I think if you end your screen sharing, you should be able to then copy that and paste it into the chat.
Okay, I'm using my positive self-talk. I can do this. I'm really good with technology. Even if it takes me a minute, I'm going to accomplish this task, and I'm going to do it in a calm manner, right? Okay, so I've copy and pasted it. Miles, I do have access to the chat?
Yep, should be right next to the share screen button.
I can do, oh, there we go. To everyone, no, panelists and attendees.
There it is. Fantastic.
All right.
Hooray. That's awesome. Does anyone else have any questions for Jeanette? I think that what incredibly wonderful information that was presented. It's useful. It was all user friendly. I found myself taking notes and thinking about things that I could use with my grandkids, because I know there are those times when you definitely are like, oh my gosh, I've had 4 kids, and yet I can't manage this grandchild who's throwing a fit. So I think it was absolutely wonderful. If if someone wanted to connect with Applewood, they could just call the number and call and get an appointment for intake if that's something that they wanted.
Absolutely. Our main number is at our Jones Home campus, and I want to say it's 216-741-2241. But if you Google it, or we're easily accessible, and you can just let them know that you're interested in services, and they'll get some more information.
Wonderful. Well, I know for one, it was an excellent presentation, and thank you so much for taking this time to present to our parents. We are going to make this available for recording, or it is being recorded, and we will make it available for those folks who couldn't see it tonight. And I just want to thank you again. You are spectacular and did a really wonderful job. So thank you so much. We'll give one more second for people if they have any more questions. And if not, we will end the webinar. And thanks again.
Thank you so much for having me, Kelly.
Have a nice night.
You too. Thank you everyone for attending.